I'm Steve Johnson, News Director for theDove TV. Check out our other videos and visit our website at thedove.us. Thanks.
Good evening, I'm Jerry Bilden. Get our iPhone, iPad, and Android app, and you can watch the Dove News on demand on your mobile device and on the Dove Roku channel as well. Now, from the Dove Newsroom this hour, the governor of Maine says negotiations with nurse Casey Hickox have broken down and that he is ready to exercise the full extent of his authority to protect the public. Governor Paul LePage says the state had been willing to let Hickox go for walks, runs, and bicycle rides while preventing her from going into public places or coming within 3 feet of others. The state previously vowed to go to court to have Hickox confined to her home against her will for the remainder of the 21-day incubation period for Ebola that ends on November 10th. Hickox, who treated Ebola patients in Sierra Leone, says confinement violates her rights. An Associated Press review of readiness at U.S. hospitals and other medical facilities shows that the nation's healthcare apparatus is so unprepared and short on resources to deal with even the deadly Ebola virus that even small clusters of cases could overwhelm parts of the system. It might have been a concern you've had should you have to go to an emergency room during an illness. But what about urgent care centers? Since they might be on the front line of treating patients for the first time, it's a concern that centers like Valley Immediate Care has considered. CEO Brent Kell says their protocol is to identify any patient who might have Ebola-like symptoms.
Our focus is going to be to not let that patient expose anybody else if they come in the door. So we will isolate them in the room, call the county health department. I understand Providence is ready to actually care and give definitive care for patients. So that's kind of our goal.
Providence Hospital has been designated one of 6 major Ebola centers should an outbreak be seen in Oregon, and it's the only one in southern Oregon. They would not talk to us about their readiness. Instead, they sent a statement stating that all Providence hospitals are prepared to follow the latest federal recommendations, and more than 400 hospital workers have been trained on the latest protective equipment. A report from the University of Oregon says most metro economies in the state are expanding at or above their normal rates. The university's regional economic indexes also say more people are looking for work around Medford, Salem, Eugene, and Bend. The Oregonian reports the increasing number of people looking for work has caused the unemployment rate to increase in some areas. Now, a quick look at our local weather conditions brought to you by Grange Co-op. For Northern California, tonight a chance of showers, overnight lows in the upper 40s. Tomorrow, rain with a high of 53, continuing with a chance of rain and 53 degrees by Saturday. For the Klamath Basin, tonight partly cloudy, overnight lows in the mid-40s. Tomorrow, rain likely with a high of 47 and a 20% chance of showers on Saturday with a high again of 47. For the Oregon coast, tonight, rain likely, overnight lows in the low 50s, a 40% chance of rain tomorrow with a high of 61 and 59 degrees by Saturday with a 30% chance of showers. For Central Oregon, a slight chance of showers tonight with a high of 46. Tomorrow, 50 degrees and a 50% chance of showers, and continuing with a chance of showers by Saturday. And for Southern Oregon, a 60% chance of showers tonight, a low of 50 degrees, and tomorrow it will rain with a high of 59 degrees. It's a snapshot of your news and weather on the Dove.